This video is about brachial plexus birth palsy. There are various types of brachial plexus birth injury. This is typically about C5, C6 and Erbs palsy. It is also known by various names like BPBP, BPBI, the various other terminologies. That means brachial plexus birth palsy or brachial plexus birth injury. Here is a child you can see. This is an 8-month-old child wherein the right side upper limb is typically in the Erbs position, whereas the shoulder and elbow are poor, whereas hand and fingers are much better. So initially we monitored. Subsequent to that, we gave a botox injections to triceps, which helped in better strength for the biceps. This was 16 months after the injections, wherein the child started having some amount of shoulder abduction, almost about 70 degrees, whereas further abduction was done, or the forward flexion was done by arching of the spine, and elbow flexion was reasonably achieved. This child undergoes a soft tissue release surgery. See, whereas the external rotation is so tight, there's no external rotation at all, whereas passively abduction is good. So undergoes basically soft tissue release and tendon transfer surgery. And this is a 3 years follow-up. Child is having a better shoulder abduction, good elbow flexion as well. And the subsequent video, it is the 4 years follow-up of the same child. Child has some residual elbow flexion, however that can be stretched out with time. So this goes to say that brachial plexus birth injury can be managed with tendon transfers when there is partial recovery initially, and later on we can manage with the tendon transfers. Thank you very much.